So it has two components that we have to differentiate. Gaining weight, it doesn't mean has a gynecomastia. Okay, it's only fat.
Only fats.
But the gynecomastia, to start with, it has a two component, or a part of it. It's two component, glandular part and
the fatty part.
Fatty part. And according to the grades, we differentiate generally the type of treatment. People that they lose weight or they gain weight, mostly their work in fat component. They don't deal with, they don't go with the glandular, they don't gain glands, okay, or they don't lose glands.
Is it possible that men might have glands in their breast?
Yeah, it's a part of the normal body to have a gland, but it is.
You mean the enlargement? Let's say.
It's no, yeah. If it enlarged, it becomes like a female breast. That's it. This is the abnormal part.
And this is due to hormonal disturbances?
And generally, the causes of the gynecomastia, it's sometimes it's physiological. Okay, physiological, that we said that the neonate after delivery, they have a glandular part because of the mother estrogen during pregnancy. Okay, they keep their glands and or gynecomastia for weeks or months after delivery, and with the absence of the estrogen gradually, and they will lose this enlargement. And then at the pubertal age, okay, and they have some elements of gynecomastia, and the last at elderly.
And which age do you start treating gynecomastia then?
After puberty.
After puberty.
Yeah,
13,
when they get
14
established and
after,
they get they have already fixed size of their breast, and it's not being resolved. We start treating them as a surgical point of view.
Of course.
There is another causes, like a pharmacological causes. Some drugs they can cause gynecomastia. Some tumors they can cause gynecomastia, and some of them is idiopathic.
And this is totally reconstructive.
It is. It is.
Totally.
It is. It is.
And do you have in your clinic or in general in plastic surgery clinics a good percentage of patients seeking to get rid of their gynecomastia then?
It is, in general, gynecomastia is common in population. It is about 30% of the population of male patients they've got gynecomastia, which is a high percent. 30%,
but there is different divisions.
Grade.
Yeah,
it's a different grade. When it becomes very prominent, they seek for surgical intervention. Supposing that they have a normal hormones, they don't have any tumors, they don't have any other medical illness associated with.
What if there was a hormonal disturbance? You treated the gynecomastia. Will the patient continue on his hormonal therapy after?
Generally, before we start treating the gynecomastia, refer to endocrinologist. They evaluate their hormones, they evaluate the patient in general, and then the last part is the surgery.
The surgery.
When they get stable hormones, they get stable patient to go for surgical excision. We do the surgical point.
Wonderful. So viewers, right now, one more thing for you men as well. Hopefully no one needs it, but it's also gynecomastia, which is the enlargement of the male's breast. You can get rid of it in a plastic surgery clinic, and it's not a shame. Hair transplantation is being so successful, and it's also not a shame. Male rhinoplasty, it only depends if you have, let's say, something not straight, your nose is not straight, or if you're missing something. We went through all of those with Dr. Bishr, and I would also like right now to talk about the caricature that Hakim just drew for us, and it's Dr. Bishr holding a before and after picture for a patient who didn't have hair, and right now he transplanted his hair. But basically this is not in Dr. Bishr's clinic.
I think even the corrected one needs more aesthetic, meat aesthetic.
So in Hakim's drawing, even the after one, Dr. Bashir told us that we can also fix it more and more.
We can do a little portrait still in the corrected one.
In the corrected one.
Yep.
Yeah, I mean, he also transplanted hair in his mustache, as you can see.
That's fine.
Okay. Doctor, I'd like to ask you about something, let's say, in the plastic surgery, scars.
Yep.
Scars. Not the burn scars. Let's say if a patient had an incision or...
Generally, we have to understand the scar. Any wound that penetrate the whole skin layers, that will leave a scar.
Of course.
The difference of plastic surgery scars than the other specialty is we deal with the scars as an entity. We respect skin. That means we will give the patient the best type of sutures, the best way of suturing to get the minimal scar.
Subcutaneous suturing.
Subcuticular, enough deep stitches, generally no tension in wounds. These would make a scar good, but generally there is no wound that would heal with no scar if it penetrates the whole layers of the skin. That means any surgery would leave a scar. This is a general rule. General rule. Any surgery that generally we do surgeries, we penetrate the skin. Any surgery would leave a scar.
But
the
there is
good
a
thing
difference.
of plastic, that we hide the scar, we make a good scars, that would make a plastic surgery different from others.
Some scars are acceptable.
Well, this is why we sometimes do a scar revision. That means we revise the scar, we remove the ugly scar, we replace it with a better looking scar.
And this method is called scar revision.
It is a scar revision.
This is an operation in plastic surgery.
Yeah, it is.
Okay, now let's talk about the interesting part in plastic surgeries in men, which is the celebrities. All around the world, they all perform, male celebrities perform plastic surgeries. And I was reading, I'm not going to say names, but I read that some of them are trying just to make their jaw, let's break the bones and try to point it ahead a little bit.